the discs are a unique structure because they're the largest avascular structures in the body. So it sets up a stage where if there is injury within the disc, it's tough to repair. The disc is only innervated when it's healthy on the outer periphery. So if you have an injury within the disc that's deep, often you don't even feel it, especially if it's a healthy disc. And later in time, when the fissure starts to separate or to open, it's called delamination. Then the whole disc will get compressed, very similar to a car tire. It will bulge. If the disc loses too much of its integrity, of its pressure, it's almost like the rims are like the vertebrae will touch, and they're very pain sensitive too. So we're learning now that a lot of the spine problems are due to discs that are a little bit slippery, or they don't hold their stiffness. Just like a car tire, you know, when your car tire is a little low, the car will not perform, and it'll kind of move in ways that is a little bit unpredictable. And that's what we're seeing with the spine now, which is quite interesting. So when you decompress, there is a lengthening of the spine, and the discs gain some height, creating more room for the nerves that exit out through these canals. And in doing so, there's a negative pressure that's elicited within these discs, and the nutrients gets drawn from the vertebrae primarily into the disc to raise the disc height. So by drawing in nutrients to these cells, allows these cells to heal very likely more effectively, because it's a desolate landscape with very little oxygen and glucose. So if you can draw in these nutrients, then these cells become more active and can metabolize and help heal up the injured structures. And by doing so, with a greater disc height, you've got more room for the nerves, there's less compression with the facet joints, and the spine is just much happier.